All right. Welcome back, everybody. Welcome back to our final session of the day, which is a about transanal irrigation, a game changer in bowel management. It will be presented by our friends at Coloplast and Wellspect. Welcome, guys, and feel free to take it away.
Thanks, Will. Can you hear us? Okay.
I can hear you, Grant.
Okay, so I'm going to try and share my screen here, unless you guys don't have this loaded up. Is that correct? All right. Let me know when you can see the presentation.
Right, I can see it.
Right, I'm going to go into, see if I can put it into presentation mode. All right, how's that looking?
Looks great.
All right, Lisa, do you want to take it away?
Yeah, perfect. Thank you. My name is Lisa Boschman. I'm a clinical nurse manager for Wellspect Healthcare. Thank you so much for joining our talk today on transanal irrigation, a game changer. We'll review the agenda next. So today we'll be talking about the impact of bowel dysfunction. What is transanal irrigation, also known as TI, and how it works. We'll talk about the benefits of transanal irrigation, TI in the United States, the help that's available to clinicians and to patients, and um, our Access and Care Coalition, and we'll review a survey that was conducted among people with neurogenic bowel and or bowel incontinence and constipation.
Lisa, do you want to introduce yourself just real quick?
Yes, absolutely. So my name is Lisa Boschman. I'm the clinical nurse manager for Wellspect Healthcare. And we have a slide that I'll show a little bit later just to introduce our clinical team. So Wellspect Healthcare is the manufacturer of low-fric intermittent catheters and Navina transanal irrigation systems. So today we'll be talking about transanal irrigation as a therapy. And yeah, so we'll get started here. We'll talk about bladder and bowel dysfunction can have a huge impact on a person's quality of life. And when they occur together, the risk of anxiety, decreased self-esteem, social isolation, and depression are even greater. So it's really important for healthcare providers to address bladder and bowel management with their patients, and for patients and caregivers to discuss with their providers to avoid the negative impacts of bladder and bowel dysfunction, and to learn about therapies to help gain control that will improve the quality of life.
Lisa, you don't have your camera on. I don't know if that's what you wanted to do, so I just want to make sure.
Okay, thank you. Okay,
there
how's that? Okay,
there you
thanks, Grant. Okay, perfect. So this slide just shows the statistics. So 95% of children with spina bifida have neurogenic bowel and neurogenic bladder. And bladder and bowel management are typically started in childhood, and interventions can change over the years, but bladder and bowel management are necessary throughout a person's life. So this slide reviews the core options for managing neurogenic bowels. There are many different treatments. Often people will start with more conservative bowel management, such as stool softeners, fleet enemas, or digital stimulation. And these more conservative bowel management treatments are often found to be time-consuming or partially effective or ineffective. And they may be looking for a more effective treatment, such as transanal irrigation. So TI, or transanal irrigation, is a highly effective therapy that should be considered prior to a more aggressive intervention, such as an ACE procedure, which is an antegrade colonic enema or colostomy. So now we'll talk a little bit about what transanal irrigation is and how it works. So transanal irrigation is like a high volume enema where body temperature water, so any water that is safe to drink is safe to use for the irrigation. So it can be tap water or saline solution, but it does need to be body temperature. And it's instilled through a pressurized system using a rectal catheter, which can either be a cone catheter or a rectal catheter that has a balloon. And once the prescribed volume of water or saline is instilled, the balloon is deflated if you're using a rectal catheter with a balloon, or if you're using a cone, the cone would be removed. And that high volume of water or saline solution stimulates the nerves in the colon to provoke a response of muscular contractions in the colon to move the stool across, down, and out. Transanal irrigation empties the rectum and the distal portion of the colon. So we have a picture over to the right side. So it empties the portion that is labeled as 2E and 2F all the way up the 2D portion, up to that splenic flexure where the descending part of the colon meets the transverse colon. So transanal irrigation empties the rectum and the distal colon, and stool doesn't reach the rectum again for an average of 2 days. Compared to more conservative bowel management treatments, people using TI have fewer complaints of constipation, less fecal incontinence, improved symptoms, which have an impact on the quality of life, reduce time spent on bowel management, and fewer UTIs. And so now I'll pass it over to Karen Spriggs, clinical specialist for Coloplast, to cover the benefits of transanal irrigation.
Thank you, Lisa. And yes, I am Karen Spriggs. I work for Coloplast. I was also, just to be, tell everybody, I was the first trainer of Peristeen in the United States more than 12 years ago, I guess, at this point, because I've been with Coloplast for 7 now. So I've been part of Peristeen or transanal irrigation in the United States since it started here. So we're going to go over what the benefits are of transanal irrigation. Next slide, please. So it's been proven to be very effective. On the left-hand side here, you can see a retrospective review. Retrospective basically means that they're kind of looking back at some previous patients that were already on transanal irrigation. And 23 children with incontinence or constipation and fecal soiling that were treated with transanal irrigation, they found that 70% reported to be clean from soiling. And an additional 13% reported a significant improvement, although they were still having some soiling episodes. But that's a huge amount, 70%, that were clean from soiling after starting transanal irrigation. And then on the right-hand side, you see the prospective study. Those were done right at that point, basically, where they had 60 children that were treated for transanal irrigation for 3 months. And what they found was before starting transanal irrigation, that there was frequent episodes of fecal incontinence, and it decreased from 5.5 episodes down to 1.3 after starting transanal irrigation. Next slide, please. So the efficacy and success rate are also very important to know for transanal irrigation. Again, the prospective study here on the left-hand side Again, these were patients that were enrolled into a transanal irrigation system. And what they found was that it was patients and their caregivers completed a self-reported questionnaire at the beginning and then at the end of the study. And what they found was that treatment was successful for 81% of the 43 children treated with transanal irrigation. And that the fecal incontinence episodes decreased from 6.9 to 0.5 per week. So they were having about 7 fecal incontinence episodes a week. And then it went down to just a half, like barely even there. And then diaper changes were reduced from 1.6 diaper changes per day down to 0.2 per day. So almost non-existent. These patients actually were able to get out of diapers for the most part and be in regular underwear, which is so huge for patients. And then the 3-year follow-up study from these patients, 86% of them were still using transanal irrigation, and that the fecal continence improvements were sustained, and also the diaper changes were sustained. So these patients were still wearing underwear 3 years later. Next slide, please.
Sorry, trying to change the slide.
Okay, no worries. Technical difficulties, right? That's what you have when you have 4 people trying to do one program. There we go. So transanal irrigation has also been proven to be very successful for children. So you can see here on these graphs that 78% of the patients, they had successful treatment for fecal incontinence, and 78% also had successful treatment for constipation, with an overall improvement score of 84%. So 84% of the patients had overall improvement with their issues, whether it be fecal incontinence or constipation.
It doesn't like it when I mute to change the screen for some. I don't know. It's weird.
Oh, that's funny.
Sorry. There we go. It's okay. I'll just be quiet.
The overall quality of life, again, this is the prospective study that was based on the patient's responses and parents' responses to a questionnaire. You can see here that for travel and socialization, beforehand, they were only satisfied with their quality of life for travel and socialization, only 23.5. Whereas after starting transanal irrigation, it went to 9.3. That means that they had more time to travel as a family, go on vacations. They were able to do socialization. They were able to go out to do after school activities, anything of that sort that was important to the families. They were able to do it more after starting transanal irrigation. And then the caregiver support and emotional impact also decreased because, again, the family, the parents are so much happier to be doing something that was designed to do while sitting on the toilet, as compared to if you're using a gravity-fed enema system, you really should be laying on your left-hand side for it to work the most optimally. And then the family relationships also improved because, again, maybe if the children had siblings, and the siblings weren't able to do any kind of after school activities, that was impactful for family relationships as well. And then the financial impact went down as well. And this is, you think about the patients that, if you have to buy the diapers, and now they're not in diapers anymore, they're just in regular underwear, that alone has decreased the financial impact on patients and parents. And that 3-year follow-up also showed improvements in quality of life, that these were all maintained, that every single person was very happy with when they started transanal irrigation and had much better impacts of quality of life overall. And then independence. This is so crucial for these patients because, again, if you're doing a system where you can't be independent, that your parent always has to help you do your bowel program, many patients are able to do transanal irrigation on their own. And one study found that 79% of the patients that used transanal irrigation were able to do it independently, entirely from start to finish. And that it led also to a greater independence overall. Again, this was a prospective study. among those 35 children and young adults, and the positive impact on their independence you can see in this bar graph, that it went from 28% to being independent up to 46% of being independent with transanal irrigation. And then the time spent on bowel management, this is also key. This is why I love the title of this presentation, A Game Changer, because this was probably one of the #1 things that was the game changer for a lot of patients and parents, that it really has reduced the amount of time that they spent on their bowel management program. And you can see on the right-hand side on the bar graph, that is depicting greater than an hour or less than an hour of greater or less than an hour doing your bowel program. So you can see that 63% of patients before transanal irrigation were spending more than an hour on their bowel program, whereas only 3% after starting transanal irrigation were spending more than an hour on their bowel program. And urinary tract infections, this is also huge. I mean, so many patients get urinary tract infections because they have so much stool that's in their colon, or they're in diapers and they're at school and they can't get to the nurse to get changed, or whatever the case may be. You know, again, in this prospective study where 60 children were treated before the trial of, before they started transanal irrigation, they would have 14 episodes. And during the trial, it reduced down to 6. So that's huge numbers for patients that are having issues with urinary tract infections with spina bifida, that it helps decrease the amount of infections. And then transanal irrigation available in the United States. I'm going to continue with this, and then I'm going to have Lisa take over. So Grant, if you go to the next slide. So, and I guess if you guys have been listening, I actually was on, so I saw the little transanal irrigation Coloplast little slide thing presentation. So you pretty much already heard this, but basically Peristeen Plus is a transanal irrigation system, TAI or TAI, you may hear it referred to as all of that sort of stuff, but it is as simple as what you see on the pictures here. There is a bag with a water temperature indicator on it. That gets changed out after every 15 uses. And then, as you saw in the video, the lid with the straw that goes inside the bag is part of that unit. That is the 90 uses. And then our catheters are single use only. And the catheters are approved for ages 2 and above. So any patient that is over 2 years of age is eligible for Peristeen. So again, our catheter has a hydrophilic coating on it that once is activated with the water that you put through the pump, it becomes very slippery or lubricious, and you will not need any sort of lubricating jelly or anything of that sort to place it into the rectum. And then again, very intuitive with the dial. The water droplets means water. You can see the balloon, and on the white picture there is the inflation of the balloon. The blue lines lining up is the storage. The one down at the bottom close to the black bulb where you push the water in and push the air in the balloon, all that sort of stuff, is the balloon deflate. So when everything's done, you go to balloon deflate, and there is no dwell time. Once you get the amount of water in your rectum that is prescribed by your healthcare provider, you just release the balloon, and then the water and stool will come out into the toilet. All right, Lisa, I'll pass it back over to you.
Okay, thanks so much, Karen. Okay, so here we have Wellspect's Navina systems. We have the Navina Smart system on the left-hand side. So the Navina Smart system uses the latest technology to assist users to perform TAI or transanal irrigation conveniently, safely, and consistently. The Smart unit pumps the water in. Okay, so the Smart unit pumps the water in, it inflates the rectal catheter balloon if you're using a rectal catheter with a balloon. It also deflates the balloon. The control unit syncs with an app on smartphones. It's compatible with either Apple or Android so that you can transmit all of the data from the transanal irrigation to the app on your phone, and you can share that with a provider so that they can assess your progress and assist with any troubleshooting as needed. Navina Systems has 3 catheter options. There is a cone catheter, a small or pediatric rectal catheter with a balloon, and an adult size rectal catheter with a balloon. All of the catheters are hydrophilic. They are interchangeable with both of the systems. We have the Navina Classic on the right-hand side, which is the manual system. So the Navina Classic system has 2 pumps. There's one pump for water, which is the dark blue, and then the light blue pump is to inflate the rectal catheter balloon. There's a toggle switch to turn the water on and off, and the black button is to deflate the balloon. All of the connectors are color-coded. The water container has a solid plastic base, and it holds 1.5 liters of water. So you can use either, like I mentioned earlier, you can use tap water as long as it's safe to drink, or normal saline, but you do want to make sure that the water or saline solution is body temperature. Okay, so we can move on to the next slide. We are here to help. So this is the Wellspect clinical team. We currently have 4 clinical specialists. We have Misty Lloyd, who is our full-time telehealth nurse. She specializes in urology, and she provides low-fric support to low-fric users. And then we have 3 regional clinical specialists. So I cover the Northeast. We have Catherine Fernandez in the West and Megan Taylor in the Southeast. The regional clinical specialists provide clinical and product education to healthcare professionals and to end users. We also offer telehealth virtual Navina training for end users as well. And that is, yeah, so that's good. I'll pass it back to Karen to introduce the Coloplast clinical team.
Yes, so we have Coloplast Care that if we get an order for Peristeen to our Coloplast Care team, they're the ones that they're dedicated for Peristeen Plus product only. We have Spanish and English available for the patients. You'll get the order, and they will figure out what DME company works best with the patient's insurance to set them up with home delivery. And then they get calls from them every so often, typically 3 days after training, 1 month, 3 months, 6 months, and 11 months. But they are there all the time for them from 7 a to 7 p Central Time, that they can reach somebody, and that person can help them walk through all the different steps with Peristeen Plus. Now, I always say they're not medical, so they can't necessarily help the patients they have some algorithms that they can help with medical questions. But Grant, if you'll go to the next slide, please. We have a team of clinical specialists across the United States that can help the clinicians answer, get the questions answered that they have, either from our medical affairs or through research studies, anything of that sort that is may be helpful for that clinician. So we have Rick Rayom as our senior manager. Then we have Amy Daniels McClure, who's out in the Northwest and West regions. We have Glenn Sully, who's South Central and Central and half of the South region. Belinda Coyle has Ohio Valley and the Midwest regions. Myself, I have the Northwest. Oh, I not have the Northeast. I'm sorry, that's a typo. Northeast, Mid-Atlantic, and Southeast regions. And then Angela Jackson has Florida and half of the South region. And as you can see, we have a varied amount of backgrounds. We have Rick, Glenn, and Angela all have adult urology backgrounds. Amy and Belinda have adult rehab specialty, and I myself am pediatric urology. So the 6 of us make up our team and are always available to help with the healthcare providers with their questions. But we're also the ones that are doing the healthcare provider in-services and trainings, and then are also there available either in person or virtually to help train the patients. And we are able to do that as often or as long as the clinician needs. It's not a one and done. If they need us to be there for 5 patients or 2 patients or 12 patients, we are available to them virtually or in person. So thank you.
Thanks, Karen. Thanks, Lisa. So for the last 15 minutes or so, we'd like to just talk a little bit about the coalition that we've put together to help with try to get transanal irrigation more accessible. And then we'll open it up for some Q&A if we have a little bit of time left. We're going to try and leave a little bit of time for that. So recently we put together a coalition. This came out underneath the United Spinal Association. It's called the Access and Care Coalition. But we were looking at transanal irrigation and finding that there was issues with people getting accessibility to this, and so we wanted to work together to make this more accessible. So we worked together with Coloplast, the Spina Bifida Association, of course, and United Spinal Association, and our company Wellspect Healthcare to really put together a survey. And we worked with Duke Health, and we had a great outside market research firm that was tremendous in really helping us put this together. We saw in Lisa and Karen's presentations that there's a lot of clinical studies done around TAI. Some of them tend to be smaller patient groups or user groups that are a part of that. But we wanted to hear from actual users or non-users or people who use TI and then were denied coverage. And so we put out this survey, I think it was last October, November. And if you were a part of this survey, thank you. Thank you very much for taking the survey and being a part of this effort to try to get transanal irrigation covered, specifically by Medicare. We've seen a positive impact that TAI has on many users. We've seen the consequences of not having TAI coverage and why the therapy really needs to be more accessible to Medicare recipients, which then also opens it up more to private insurances and Medicaids and things like that. So again, I mentioned that if you were part of the survey, thank you again for taking that. We went out to Spina Bifida constituents, United Spinal, Wellspect, and Coloplast customers, and it was about 1,130 people all told. So we had a really good response rate. And we just want to show that we had a really good balanced response rate from across the United States. So again, all this information that we're trying to collate here and put together is in an effort to go to CMS, Medicare, to present this information to them. And this is from actual users and show them the impact that TAI can have on people out there that really need this therapy. So we had a good representation across the country for the survey. And we had a large population take the survey from the Spina Bifida Association, which was great because this is really one of the groups that really needs accessibility to this therapy. So we had a good cross section of people taking the survey. And from this side, you can see that there's an impact of sorry, hang on, moving something out of the way. You can see on the left the physical symptoms of neurogenic bowel dysfunction among TAI non-users and previous users. You can see from this really corroborates the study information that you saw earlier, that fecal incontinence and accidents, 68% of the people reported this, spending long times on the toilet and having a bowel movement, constipation, fecal impactions, things like that. And down at the bottom, you can see we kind of collated some of this together. The net of constipation and incontinence issues, 82% of the people mentioned that they had these issues. And then also that one of the main issues is making trips to their doctor, medical provider, or even to hospital ERs. And then you can see on the right how TAI has impacted the physical symptoms of NBD among current TAI users. So everything that's on the left that is a symptom of and issues that people are having, you can see how TAI is really benefiting people by using this therapy. You can see down at the bottom again the net of less incontinence, constipation, and fecal impaction. 83% of the people reported the positive effect of TAI. And also you can see almost a third of the people were making fewer trips to their physician, their medical provider, or to a hospital ER. So again, really, very good results. And this is real world people saying they're giving us their opinions of transanal irrigation and how not having it is impacting their life. And here you can see the impact of using TAI in the quality of life. They're having less concerns about accidents. 68% are reporting that. Increased independence, that was one of the other issues that one of the other positive impacts of TAI that you saw in one of the studies. Also, almost 3 in 10 said they avoided bowel surgery as a result of using TAI. I think that's really critical. This is a therapy that provides people an option before having to go to have a surgery, and that's something that we really want to highlight from this study when we go to talk to CMS about getting coverage for transanal irrigation. And you mentioned that you heard that there was a huge drop in the amount of time spent on bowel management when using TAI. And again, this study this survey shows the exact same thing. 60% of the people reported less time on spending less time on their bowel management since using transanal irrigation. So all this data, along with the clinical information, the clinical studies, and this survey, we can present to CMS and really make a good, strong case for why this therapy really needs to be accessible in the U.S. Amongst Medicare recipients, which again, I mentioned, this will also help open this therapy up to private insurance. Will see this and really take heart that this is a therapy that is working and will work in the future. Acela is on the call. I'd like to have Acela talk a little bit about the support that we're trying to get here for transanal irrigation.
Thank you, Grant. I really liked the information that Grant provided about the coalition and its goal. And it's very important that we draw on your efforts and your experience to bring that message home, not just to CMS. That's the first phase. We work with CMS, but we also need Congress to help us in the process. And so one of the things that Spina Bifida Association has prepared is a leave behind for you to share when you meet with your congressional representatives. We want to tell them we are working with CMS to be able to include TAI under the Medicare program, but we may come back to you if CMS is not receptive to our message. And as Grant noted, the key here is Medicare coverage, because as you know, Medicare causes a ripple effect. And if Medicare doesn't cover a product, then private insurance won't cover it, or at least many of them won't. But if Medicare covers it, that opens up the world of better coverage in the private sector for everyone who needs this device. So the message is explain what TAI is and what it's used for, and what NBD is and its impact on you as a patient or as a family member, individuals who have NBD and Spina Bifida, and how this is important to your day-to-day life. See the results that Grant was sharing from the survey. The largest number of participants came from Spina Bifida Association. And so the message strongly is this helps us. It's important for our well-being. It reduces costs with respect to other expenses that we may, medical expenses that we may have. It helps us avoid more invasive procedures. For example, a ACE procedure, as Lisa was explaining, or colostomy. And these are sort of the last tier of interventions that patients with NBD face. It would be so much better to have something that is minimally invasive, like TAI, to deal with the symptoms of NBD. So it's important for you to bring this message with your personal stories to Congress. That's what Congress cares about. CMS likes to have data. They like to have studies and big numbers to look at. Congress is interested in your stories because you vote to keep them in office. And so that is their primary driving force for their job. You control their job. They owe you a duty to listen to what your problems are or what your concerns are, and in turn, try to help resolve them. So the message is, please support including TAI devices under the Medicare program. They help us, they're safe, they're effective, and they actually help reduce other healthcare costs. And so with that, we turn to the next slide to give you a flavor for some of the other activities that as an organization, Spina Bifida is supporting to help bring the message home that TAI devices need to be covered under the Medicare program. There needs to be better access. And one of these events will be a health equity event at the Danish Embassy in Washington, D.C. And the intent of the event is to highlight the health disparities that impact individuals who use TAI. A part of the event will also include intermittent catheterization and some of the issues and disparities that individuals who use IC also face. It's going to be a small event, but it's going to include representatives from consumer groups, providers, and government officials. And the message really to them is, this is important. The ability to control the bowel and the bladder has almost uniformly been identified as the most significant concern for individuals who have MBD. So this is an event that will help emphasize the need for an effective, cost-effective, safe, non-invasive solution or intervention for NBD, because if those earlier interventions that Lisa was discussing about fail and TAI is not available, then many people will be facing the need to have a MACE procedure or a colostomy. And I'm not a clinician, but my understanding is that there's different likelihoods of these kinds of procedures not being permanent. And that may be something that we can discuss during the Q&A, because I noticed there were some questions pertaining to that coming up on the chat. So excluding TAI from Medicare exposes individuals with NBD to risk of serious complications, emergency department visits, and the need for more invasive treatments. And all of these complications, emergency department visits, and other invasive treatments raise the cost of treating and caring for individuals who have NBD. And aside from your personal message, as Mike Wood said, share your stories. Aside from that, Congress is also interested in how much money they spend on the Medicare program. So it's safe and effective. It allows us to avoid complications that at the end of the day increase costs to the Medicare program. So Grant, I'll throw it back to you, and maybe we can open up for questions if we have a few minutes left.
Thanks, Estella. Yeah, I just want to point out too that ostomy, surgical procedure, conservative bowel, they're all options that are on the table for people, and people need to choose what works best for them. We just want to see TAI also in the mix of that, and also we want to have coverage for that, so it is available, more accessible to people to use as an option, and not have to maybe go to getting a surgical procedure because the TAI is not covered. So we just want to make it option. We want to have an option on the table for people with that have Medicare, and then, as you mentioned, that opens it up for a lot of coverages in the private sector.
And that's an excellent point. It's not that it's TAI and nothing else. It's the ability to make the choice of the conservative treatment didn't work. Do I want to try one more step before I move forward with something that might be more permanent and invasive?
Stella, did you want to say anything about the reimbursement disclaimer, or just have it here for a minute?
No, well, essentially, I'm not sure we really spoke about reimbursement information on this call, but essentially, whatever our presentation as a whole really is not intended to drive any clinical decisions or any purchasing decisions. That's something that is for you to decide, consulting with your advisors.
Okay, great. Thank you. So yeah, I guess we can open it up to questions now. Does anybody have any questions?
Actually, the main question I've seen people ask is if you could explain how it's most commonly used, or how it would be independently used, one of these systems.
So maybe Karen or Lisa can respond to that question.
Sure, happy to. Let me just turn my video on here. There we go. Okay, so how is the system independently used? Was that the question? Yeah. Okay, so the transanal irrigation therapy is carried out sitting on the toilet, ideally. And because it's a pressurized system, the water container can be placed on the floor, on a countertop. It really doesn't matter where the water container is situated. So then the catheter is inserted into the anus. And if using a rectal catheter with the balloon would be inflated, the water would be instilled. So by using the rectal catheter with the balloon, you don't have to hold the catheter in place the whole time. If you're using a cone catheter, that would need to be held in place during the installation.
Great, great. And another quick question we're getting, a lot of people want to know about potential side effects.
Sure. A couple of side effects that I'll mention, and Karen, please feel free to jump in. But so if you were to use cold water, that could potentially cause cramping and be uncomfortable. Water too hot could potentially damage the intestinal tissue. So those would be a couple of side effects. There are a couple of risks that we always review in training. They're very rare, but ones that are important to know about. One, which doesn't typically apply to the spina bifida community, but autonomic dysreflexia and bowel perforation, which occurs in 1 in 500,000 irrigations. Karen, is there anything that you wanted to add to that?
Nope, the bowel perforation is always the one that comes up. And what we're told for the statistics is that if you have a colonoscopy, 1 in 1,000 times will you have a bowel perforation, whereas with Peristeen, it's 1 in 500,000 times. So very, very rare, very low statistics for a bowel perforation. But it's why we feel and I'm sure Lisa feels the same way, it's very important for us to train the clinicians, to train the patients appropriately so that the patients are doing it correctly and not causing bowel perforations.
Great, great. Well, we thank you guys so much. Very informative. We appreciate your time. Heidi, I hear you got some housekeeping notes before we head on out for the night.
Yes, thanks, Will. So yeah, this concludes our first day of Teal on the Hill. Very successful, a lot of great information and a lot of participation, and we appreciate that.